गुड मॉर्निंग एवरीवन। आज के इस क्लास में हम समझेंगे व्हाट एग्जैक्टली इज़ मैकेनिज़्म ऑफ मॉर्फिन। मेरा जो पिछला वीडियो था जो मॉर्फिन वाला, जिसका हम साइड इफ़ेक्ट्स पढ़ रहे थे, उसमें मैंने देखा कि मॉर्फिन का जो व्यूज़ है बहुत ही अच्छा गया था। लगभग 21-22 हज़ार प्लस व्यूज़ गया था, जो कि बहुत ही अच्छा है एक न्यू चैनल के लिए। लेकिन उससे मेरे को ये भी एक समझ में आया कि जो मॉर्फिन है उसके बारे में लोग ज़्यादा जानना चाहते हैं, एंड दैट इज़ वाई एक फॉलोअप वीडियो में लेने के बारे में सोच रहा था, और आज का ये वीडियो उसी के बारे में है। सो इन दिस पर्टिकुलर वीडियो टुडे विल डिस्कस अबाउट मैकेनिज्म ऑफ मॉर्फिन. So in this particular part of this video, first we have to know that morphine is a natural opioid analgesic. So opioid analgesic are the drugs which reduce pain, basically, if you go by the rough definition. But when it comes to opioid analgesic, means they act on central nervous system. So they work there and they do their job by reducing the pain, but the primary mechanism is they act on the central nervous system, that is brain and spinal cord. So here what is saying that morphine is a natural opioid analgesic. So it is primarily found from natural source, and that is a plant. The plant name is opium poppy. So historically, in our primitive ages, what people used to do, they collect this plant, they collect the juice of this fruit, and they used to administer for the relief of pain, and that was actually accidental. There was no research, and people accidentally used it, and later on they found out that this has some medicinal value and this reduces pain. So it is a prototype, obviously. सबसे पहले इसी के बारे में ही हमको जानकारी मिला था, मेडिकल साइंस को पता चला था. Now, how actually does it reduce your pain? How does it work on the CNS? To understand this, first we need to understand that morphine, as a part of the opioid receptors, it work on a specific type of receptors. Those are called opioid receptors. So morphine work by binding to opioid receptors, which are G protein coupled receptors. ये जो morphine है, ये opioid receptors में काम करता है, और ये जो opioid receptors है ये एक प्रकार के G protein coupled receptors है. हम पहले से भी पढ़ चुके हैं. There are 4 main types of receptors. Those are your enzymatic, ion channel receptors, G protein coupled receptors and nuclear receptors. तो ये जो morphine जो bind होता है opioid receptors में, ये सब आपके G protein coupled receptors कैटेगरी में आते हैं. ये जो मॉर्फिन रिसेप्टर्स हैं, जो ऑपोइड रिसेप्टर्स हैं, ये पर्टिकुलरली 3 प्रकार के होते हैं, दैट इज म्यू, कापा एंड डेल्टा. सो बेसिकली दे वर्क ऑन म्यू रिसेप्टर्स, एंड दिस इज द प्राइमरी साइट फॉर द मॉर्फिन, एंड दिस म्यू रिसेप्टर हैज़ द हाइएस्ट एफिनिटी फॉर द reduction of pain, and morphine has the highest affinity for the mu receptor. Now moving on, the morphine receptors or the opioid receptors are primarily located in 3 main parts of the central nervous system: in brain, in spinal cord, and in peripheral tissues. So basically in brain it is especially found in, that is, periaqueductal gray matter of thalamus and limbic system. In spinal cord it is particularly found in dorsal horn. In peripheral tissues it is found in nerve endings. So by acting on all these sides and all these your mu receptors, they multiply the level of neuronal blockages, reduces neural stimulations, and ultimately reduces pain sensation. Now moving on to the mechanism of the morphine at cellular level. So what exactly happens? First, the morphine binds with the mu receptor, which leads to activation of the mu receptor. After the activation of mu receptor, the G protein, which is part of this G protein coupled receptor, which is a mu receptor, that G protein is activated. The G protein inhibits adenylyl cyclase, which is a secondary messenger, which ultimately leads to reduction in cyclic AMP levels and leads to reduction in neurotransmitter release. Now, when there is reduce in neurotransmitter release, it opens potassium channel, and increases potassium efflux, leads to hyperpolarization, the neuron becomes less excitable, and ultimately the calcium influx is reduced and the neurotransmitter release is reduced. When the neurotransmitter release is reduced, then the nerve conduction, the nerve signal is reduced and the pain sensation is reduced to be transferred from a particular area of injury or inflammation to the central nervous system, which causes the patient to have lesser or no sensation of pain. Now, as you can see on the diagram, it is clearly indicated how the morphine binds with the G protein coupled receptor, which leads to reduction in adenylyl cyclase, reduction in cyclic AMP, and which ultimately leads to reduction in neurotransmitter conduction. Now, finally, what happens after all these steps and processes? The final result is analgesia, that is reduction in pain sensation. So what exactly happens? It blocks the transmission of pain signals at the spinal level. It reduces the emotional response to the pain at the brain level and produces euphoria, which contributes its additive potential. So not only morphine reduces the pain signal, but also it increases the emotional response to the pain. It reduces the emotional response to the pain at the brain level and produces euphoria. That is why it is more powerful, more effective than any other NSAIDs or any other drugs. So that is all about mechanism of morphine. Thank you.